Good evening. It's Sturbridge Board of Health. Our meeting for Thursday, February 11th, 2021, 6 p.m. This is a virtual meeting. Open meeting law pursuant to the Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, general law, Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Sturbridge Board of Health will be conducted via remote participation. To the greatest extent possible, specific information and general guidelines for remote participation can be found on the town's website at https://www.sturbridge.gov/town-administrator/pages/how-access-virtual-meeting. For this meeting, members of the public who wish to listen and watch the meeting either online via the town on-demand video broadcast on the cable television channel 191 or dial into the meeting at 774-304-1455. Enter 1428# for the meeting number and 12345 for the access code. This phone number is only active for the public during this meeting. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so despite our best efforts, we will post on the town website an audio or video recording, transcript, or other corresponsive record of the proceedings as soon as possible after the meeting. So I'll just take a roll call real quick. Linda Kokalis is here.
Rich Volpe's here.
Jamie, you want to introduce yourself? The board's all here.
Sure. Jamie Terry, I'm the Emergency Planner for Region 2 for Public Health. Thank you for having me tonight.
Thank you for coming. Ken?
Hi, Ken Lacey, Health Agent for Health Department in Sturbridge.
Okay, great. So this is our COVID-19 vaccination presentation to everyone who is listening, watching, and hopefully if there's any questions, we'll be able to take those questions. We're going to let Ken Lacey actually start the presentation. So Ken, why don't you kick this off with the presentation?
Okay, thanks, Linda.
Thanks very much.
So we're making a presentation this evening on our COVID vaccine plans and what we have planned for you for Sturbridge residents. We've got a PowerPoint presentation from the Health Department that we'd like to present, and we'll take some questions and answers after that time. Let me move this around. I got to read this, get to my slides.
Okay.
So this presentation is designed to inform the residents of Sturbridge about the COVID-19 vaccine and vaccination plans for our community that align with the state's prioritization list. What are the benefits of getting vaccinated? The COVID-19 vaccination can help keep you from getting COVID-19. All COVID-19 vaccines currently available in the United States have shown to be highly effective. Wearing masks and social distancing help reduce your chance of being exposed to the virus or spreading it to others, but these measures are not enough. Vaccines will work with your immune system so you'll be ready to fight the virus if you are exposed. The combination of getting vaccinated and following CDC recommendations to protect yourself and others offer the best protection from COVID-19. The more people who get vaccinated, the faster we can get back to our normal lives. What vaccines are available? There are two vaccines that have received emergency use authorization from the Federal Food and Drug Administration from companies named Pfizer and Moderna. The Pfizer vaccine requires 2 doses to be given at 21 days apart, and the Moderna vaccine requires 2 doses to be given at 28 days apart. Both vaccines are 95% effective at protecting people from getting sick from COVID-19. These vaccines were not studied for use as single dose. People should get both doses to be fully vaccinated in order to be effective.
Ken, do you want me to jump in there and tell you that Johnson & Johnson is hopefully slated to be moving forward with their approvals in the next couple of weeks here, and I think that they're still moving forward to try to determine the exact efficacy rate of the vaccine, but it is another option that we expect to hopefully come out and receive that emergency authorization approval over the next couple of weeks. And if it does, I believe the way it's slated right now is it's a 1 vaccine instead of 2, just to add to your presentation, if that's okay.
No, that's good. I appreciate that. And I held off on it because it hasn't received its authorization use yet, but you were spot on with that.
I apologize for jumping in then. I just felt like I would add that to your list.
Not a problem. Thanks, Jamie. Are the vaccines safe? Vaccines go through more testing than any other pharmaceuticals in the country. First, small groups of people receive the trial vaccine. Next, the vaccine is given to specific groups of people, for example, people of a certain age, race, and physical health. Then the vaccine is given to tens of thousands of people and tested for effectiveness and safety. After that, the Advisory Committee on Immunization Practices, located at the Centers for Disease Control and Prevention, looks at the data to see whether the vaccine works and is safe. The Advisory Committee gives advice to the United States Food and Drug Administration, also known as the FDA. The FDA looks at the data and the advice from the Advisory Committee and decides whether to approve the vaccine. The vaccine is only approved after all of these steps are done and the experts are sure that it works and is safe. Do the vaccines have any side effects? Serious side effects from vaccines, including the COVID-19 vaccine, are rare. It is possible that some people may have side effects, which are normal signs that your body is building protection. The side effects may affect your ability to do daily activities, but they should go away in a few days. The most common side effects are minor and include tiredness, chills, headache, nausea and or vomiting, pain at the injection site and or joint pain, and fever. When can I get vaccinated? To learn more, you can visit mass.gov/COVID vaccine phases. At that site, you're going to learn when you're eligible to get vaccinated. The priority list is updated on Tuesdays and Thursdays and seems to be being modified every week at this point. Where you can get a vaccine. New locations are opening up weekly, sometimes daily, but definitely weekly. And how you can register for an appointment. There's a map that shows locations and gives registration information. You can also visit mass.gov/COVID-19 vaccine for a map of Massachusetts and updated locations. There are mass vaccination sites, such as Eastfield Mall, and Fenway Park, and one opening up in Worcester, and we have one at the football stadium.
Gillette.
Thank you. My brain was moved for a second.
No problem.
Every week we're getting closer to the pharmacies and grocery stores opening up vaccination sites. There are clinics that are open to anyone who is eligible for a vaccine, and some boards of health are partnering up to offer vaccine to the communities on a regional basis. This also includes us. The Sturbridge Board of Health has partnered with surrounding health departments to support 2 clinics that are vaccinating our eligible residents. We have partnered regionally with Harrington Hospital, and they have a satellite clinic located at the Southbridge Armory, located at 153 Chestnut Street in Southbridge. We have partnered with, I think, 18 other communities to help stand that clinic up. We have also partnered with Palmer, who has 8 communities, partnered with them, and their clinic is located at the Converse Middle School, 24 Converse Street in Palmer. Big question we hear all the time is, why do I have to travel to get a vaccine? Currently, the vaccine supplies and therefore appointments are limited as states are trying to vaccinate as many people as possible and manufacturers are trying to outpace demand. Efficient vaccine clinics require a lot of resources that most communities do not have on their own. Working regionally, towns are pooling resources to be as efficient and equitable as possible. The state is expecting clinics to be stood up and run for longer duration than our usual flu clinic model. Currently, clinics are expected to be regional and able to run for 90+ days. In partnership with TriEpic and Public Health Emergency Preparedness, Region 2, also known as PEP, the Sturbridge Board of Health signed on to support 2 regional clinics, Southbridge and Palmer, that are vaccinating eligible residents. Mass vaccination sites in the state are highly efficient due to the size and scope and have the ability to vaccinate thousands of people each day. These sites are the state's preferred location for our vaccination. More pharmacy and grocery store locations are opening up every day. As you just heard earlier, CVS looks like they're going to be opening here in town tomorrow to start vaccine. So with the opening of each one of those, that makes it easier for people to get vaccinated as we continue sort through priority groups. If you need help making an appointment, we have partnered with our senior center. So for eligible seniors age 75+ as of 2/5/2021, you can contact the Sturbridge Council on Aging at 508-347-7575 or the Health Department at 508-347-2504. The Senior Center and the Health Department staff are available during normal business hours to take your call. Our staff will find a location as best we can, complete the registration on your behalf, and help set appointments. Appointments are booking up quickly, and every attempt is being made to help you get the next available appointment at either Southbridge or Palmer vaccination clinics. All other eligible residents, you may call 211 and a representative will assist you in registering for an appointment at any location in Massachusetts. I guess additional discussion is, what is our health department doing on top of that? On top of our efforts towards clinics and vaccinations, our health department resources are being stretched thin during this pandemic, and we are doing what we can to protect our community in more ways than we have ever had to do before. Our commitment to protecting the public health continues in ways that are often unseen and unrecognized. Our staff works with many stakeholders, including school administration, all business owners, to assist with actively preparing for the safety of our community while adhering to the guidance provided by the state. Our public health nurses are actively managing positive cases in our community, as well as completing contact tracing. In addition, our health agent and the health inspector continue to enforce state sanitary code, which includes our Title V well and septic plan review and inspections, food code, which is a food establishment plan review and inspections, housing code, hotel and rental property inspections, pools, spas, beaches, campgrounds, mobile home parks, tanning, tattoo, and tobacco inspections, as well as many other responsibilities. You can learn more at mass.gov for updated information on your eligibility to get vaccinated, and more, visit CDC for more information about each vaccine and other ways to protect yourself and others. For general questions about the vaccine, please call the health department. We can talk to you at length at 508-347-2504 or email bohadmin@sturbridge.gov. In addition, if you are a doctor, nurse, EMT, or paramedic and would like to volunteer to administer a vaccine at a clinic, please email your contact information to bohadmin@sturbridge.gov. We'd be happy to get you signed up and working on clinics. Other than that, it's just our members and staff. Like, thank our Board of Health members, Linda Kalis, Rich Volpe, Dr. George DeBusk, our Health Department staff, Trish Valentin, Kayla DeBuff, Ken Lacey, and our public health nurses who are working diligently through this. Cheryl Linsky, Lisa Munier, Michelle Saramet, Kathy Charette, Ashley Chikayev, and Susan Kablara. At this time,
Also, don't forget to mention Leslie Wong. at the senior center. I know you spoke about the senior center, but Leslie and you had been working pretty diligently together. So
I'd like to give a big shout out to Leslie and her staff, Leslie, Marcia, and Jen at the senior center, who were working tirelessly to make sure we get our seniors, our 75 plus seniors, registered and with appointments for vaccination. They're doing a great job, and I hear great things about them.
Okay, don't we also have some EMTs that are volunteering too?
I was just going to ask you that.
We currently have 2 paramedics that are volunteering, that are doing vaccinations. I'm hoping that a few more will come forward and do that. They just signed on this past week to start doing vaccinations. So.
Do you want to name them or no?
No, I'm not going to name. I don't know if they want to be named at this point.
Okay.
So. But I'd like to open up for questions and comments. I'd like to discuss a bit more on why we've gone regional. So if I maybe open up to Jamie for a couple of seconds to discuss the regional planning, what made us go regional, why we're supporting this, and what it's doing for us or for our community on a whole.
Sure. Thanks for having me tonight. I think that I would like to commend you as a town for all that you've taken on and all the different ways that you've moved forward through this entire pandemic. I know there's been a lot of different avenues that have had to be explored and then mastered in a very short period of time, including enforcement and contact tracing and testing for schools. I think that I've worked hand in hand with Ken a lot of the times through this process, and I feel like he has put a lot of effort in for your community. So I think that's something that he will never take enough credit for. And I would like to say that publicly, that he's done a really great job and dedicated a lot of himself into dealing with this pandemic. I think that Harrington was kind of an easy partnership to start because the people have been really great to work with. And we started it back before school started, and we kind of set it up as a group of local communities. I think there's 18 towns that work together on this, that were looking at what happens if we needed to get testing done really quickly, and there was limited access to testing at that time. And Ken was one of the partners that we worked with, Jess Caladisi at Harrington, to set up, she's the director of nursing, to set up what would we do for testing. And I know we've had to use it multiple times through the school district, through the regional school district, and it's worked really well. I think that the citizens have been well served from that. That blossomed into continued partnership, and the partnerships have now led us to this, I think, fantastic setup of vaccine availability. And I think it's given us a great way to serve our communities and in a very rapid way, where some communities in Massachusetts are still trying to figure out the best ways to bring vaccine to their residents. And I think you should be proud in Sturbridge that you have a team that cares enough to make sure as soon as vaccine is available to you, it's brought locally to an area where you have the ability to receive it. So I'm happy to answer any questions you have. I know we've done, I want to mention, I guess, that as a region, you hosted Sturbridge, a flu clinic this year, that you were able to bring together all of the Tantascwa Regional School District towns to drill in case we get to that phase 3 general population and there's a lot of vaccine available. Then you have the ability to work with your partner towns that share the same regional school district and get that vaccine out in a drive-through setting. So you should be proud of that too. So that brought some towns together that sometimes are hard to bring to the table. So I think there's a lot that you should feel value in there. I'm happy to answer any questions you have.
Ken, let me ask you a question. I think we've already gone through this, but what is Sturbridge doing specifically in the event that we get to the phase 3 where we're going to be doing mass vaccination?
Can you qualify that question? What
Well, I mean, like, you've already applied for the number for Sturbridge.
Yeah, we applied for the MIS number, which is, as Jamie's worked me through, this is a couple-month process. We started that process. It is evident from the state at this point that they're really not looking for us to run individual clinics until we have enough vaccine regionally
Right.
to support everybody. So
I know that.
they have
So, but
full
these are
punch
some
on
of
that.
the,
They've been very, very, very vocal on that. So we've applied for the MIS number, which is the first step in a three-step process. And once that happens, I've got to get all the way through the training and then eventually get to an MCVP number and apply for Prep Mod and get Prep Mod up and running here. So we have a long three-step process to happen before we can get to a point where, if eligible, we could run an actual clinic here on a town level. So,
And I'll add to that some communities locally have gone through that same process and applied for vaccine and been passed over for a couple of weeks now. So I think that it's great that you're going through the process, but even if you had the process in place, like Ken said, the state is not looking to, there's not enough vaccine right now to be able to give it locally, so that's not an option right now.
and Ken, to put it in perspective, here's another question. We've gone through some of this stuff already. It's just so that the public can know. To put it in perspective, although we're partnering, and Palmer is doing this on a regional basis with some partner towns, can you tell us approximately how much vaccine Palmer is currently getting, and how many residents a week has Sturbridge been able to send to Palmer?
So Palmer is currently receiving 100 vaccinations a week. That's what the allotment is.
Right. The whole week through how many towns that have been involved?
8 towns.
So 8 towns divided by.
We get 14. They've broken up that every town has got 14 slots, and we're using those slots between our office here and Leslie at the senior center. There's staff down there. We were full up. We opened up the clinic last Friday, and Jamie and I were both there for most of the duration. It was nice to see the group of seniors that made the trip out for that. I can see a lot of seniors from the Warren, West Brookfield, and Sturbridge area, some seniors from Brimfield, people I've known for years. That was nice to see them out and doing their thing. And it was well received. It was very much on a flu clinic feel. So they felt quite at home, and it was at the Converse Middle School, so they were out of the weather, and they were protected the whole time, so they were happy with that. But it truly was, it was 14. The plan for Palmer initially was 5 days a week, 100 vaccines a day. What we were shooting for when we entered into this. They've been issued 100 vaccines a week, so we're only doing it 1 day a week, and we're not sure how long that's going to last. We hear different things every day.
And I already know the answer, so I'm still going to ask it because I know there's probably people that want to know the answer. So how is that in comparison to what we're doing with Harrington, for instance?
Harrington, yeah.
So Harrington was when they started their clinic and started running it, they were running at about 180 vaccinations a day. And through the partnership we had, and you see the emails that we send out to the board through Ed Moore and whatnot, they were pretty much maxed out with their staffing capacity and reached out to us regionally. And we made a decision at that point regionally to start helping stand up the clinic there, because the capacity is much larger than they can possibly do with their staff.
Right. So what are they saying about a day now?
So the 12 towns that we're doing that, the 12 towns that are supplying volunteers and staff there have now got that up to, yesterday did, I think it was 458 vaccinations, and then the plan tomorrow, Friday the 13th, Friday the 12th, they already have 500 scheduled vaccinations for tomorrow. So they're hitting the 500 marker at exactly the same time we planned on them hitting the 500 marker. They said 2 weeks from the inception, they were hoping to be at 500, and it looks like they're going to be at 500 2 weeks from inception, which is fantastic.
Ken, let me ask you this question. Are they considering Saturdays vaccination days?
They are considering Saturdays, but we're not sure they're going to get people to do that because they're going Monday to Friday, 7 to 7, and it's really, honestly, they're at their end of how many people they can pull out and keep staffing that is what it is. It's a staffing situation. And I know we've talked at length at this, but we've planned and prepared, and we've got our communities ready for this for about 20 years. We go out and do a flu clinic, and it's a one-day activity, and everybody shows up and they have a great time and get a shot and they go home and feel great. These clinics are very top-heavy on the administrative side. The number of shots that you put in
we have to consider. Do you know approximately how many Sturbridge residents so far got their first shot, or the seniors?
I know that we have 280 that have either had their vaccination or are booked in the next couple of days to be vaccinated.
Okay.
So we have 163 on the 75-plus range in Sturbridge. And right now, I know we have 280 that have are either booked in this week or early next week, or already have their vaccine, their first shot.
Okay.
So
And I can just add to that. Today, Harry Lemieux from Harrington told our regional group that he's pulling some numbers so that he can tell us how many people have gone through from each of our communities, but we just don't have that data yet. So at some point in the near future, I'll get that to Ken, and he can get that to you.
Excellent. Thanks, Terry. Jamie. Terry.
thanks, Jamie.
Some other questions that are coming up that I've been asked. If we get the vaccination when they open it up, Sturbridge will be able to start providing the vaccination. Will we be able to do it? I mean, we're in the process right now of applying for the number. Then we have to go through the 3-step process, basically, correct, Ken?
Correct. And we have plans that we're working on with our nurses, with the fire chief and the paramedics. We have a plan to do, if we get vaccination, to do our shut-in population, maybe in March, late February, if we get the vaccine. We do have plans for a 1-day or 2-day clinic, possibly at our schools, if we get the vaccine, and we can actually run those. I do know that I've been working with Lisa, and I've been working with Joanne over at Quabog, and we're working diligently with CVS, with Walgreens, with anybody that would like to partner with us. We've been working to try and get a clinic in here to cover certain segments of our population, and that's just not happening right now. So we're looking at all avenues.
Ken, I didn't mean to cut you off, but Jamie had mentioned something about on your regional meetings when you all had spoke about the shut-in population. You had mentioned something about, I mean, this goes all the way up to Governor Baker, I guess, whether or not they would use the National Guard to maybe possibly use the National Guard to work with the shut-in.
Yeah, we can both speak on that. We've discussed it, and I know it's been sent up our chain of command into MDPH, so I know that Jana's heard it, and I know that other regionals have heard it, so that is one of the discussions that we sent up line to see if that could be taken care of on a regionally, that if the National Guard could come and do that. We're just not sure. They sent them out and did it for some testing, and they sent them out a bit and did it for a little bit of the vaccination when they had the shut-in, when they had the congregate care population.
The nursing home stuff, yeah.
We're just not sure if they're going to continue to do that, or if they're willing to do that for the one-off type thing, where you've got a couple, or if you got one person in the house. We're not sure where the state's willing to allocate their resources at this time.
Okay.
Melinda, Mary Dowling, can we? The public also ask questions?
Yeah, Mary, I just wanted to give Rich an opportunity first, but yeah, absolutely.
Hey, Mary.
Oh, okay, I don't know who's. I'm not on. I'm only on the phone, so I don't know. I'm trying to recognize people's voices. I don't want to. Am I the only? Are there a lot of people from the public? Do you know if listening in?
It looks like there's 7 people total. I think you're the only caller in.
You're the only caller, it looks like, Mary.
Oh, okay.
We don't know if
I
there's
just got home, so that's.
We don't know who's this is being televised on the cable channel too. So.
Okay, that was one of my questions. Okay. So let me just understand. Okay, I'll be honest. I brought up at the Board of Selectmen meeting that it would be good if we could have a clinic in Sturbridge once it opens up to the general population. And from what I am understanding from listening is right now there's not enough vaccines for that anyway. But my question is, it's only at, we're not even at that phase yet, I understand that. Am I understanding correctly that the Board of Health through Ken, you have applied to be a site, a state site to administer the vaccine once it opens up to the general population, and once there are enough vaccines, you are working with Walgreens and CVS to get a site in Sturbridge? That's my question.
Mary, I have applied for our MIAS number. That doesn't mean...
I'm sorry, tell me what that is?
It's the first...
It's the mass immunization program. So you have to have an MIAS number in order to be able to give any immunizations across Massachusetts. And it's basically the way that the state would... Sorry, Ken, I didn't mean to jump in.
No, go ahead.
Not that I could answer it. It's basically the way that the state would register the people that have been vaccinated. So if you were to go to a site because you were eligible and receive a vaccine, then that information needs to be submitted to MIAS, and that's what's submitted to the federal government to prove that the vaccines have been distributed.
Okay, so can somebody explain, so you have applied for that first step, and so what is the three-step process to become a state site? We're trying to do that? Am I understanding that? Or?
So let me qualify that on that. We haven't applied to be a state site. We applied for our MIS number, which allow us to eventually receive vaccine and run a clinic or run clinic type stuff in town. So we haven't applied to be a state site by any means. It's a much larger undertaking than we can possibly pull off in Sturbridge. We've applied for the number, so when we could apply for vaccine and maybe do our day clinic once or twice or a couple times throughout the spring if it's available. If that makes sense.
So did Palmer jump the hoops to become a state site?
Palmer is a regional site, yes. So what's going on right now, and they're not a state site. They're regional private site, and they didn't jump through hoops. They had an MIS number already available that was just dormant. And they reactivated it, and they went through a regional process to be allocated that spot. MDPH evaluated all these applications that are out there. So Palmer isn't a standalone site. It's not Palmer. It's Palmer Regional.
It's regional. I understand. And so we don't have any, the Board of Health isn't going to try to be a regional site in Sturbridge. You're going to try to do one day, hold on, just so I understand, you're going to try to do one day clinics for... I understand the seniors are getting taken care of. I get it. You're working very hard. Leslie Wong has worked very hard. I'm wondering about when it opens up to the general population, because with Harrington servicing, I thought it was 15 towns with the vaccine, but maybe it's 18. I don't know. I was told 15. Seniors who didn't go through Leslie were having a hard time even getting in there. They were told, the end of March for their first vaccine. Now, she did get others, and I'm sure you did too, Ken, get them in earlier. But all I can think of is when this opens up to the general population, hopefully sometime in the summer. I know they're saying April to June, but who knows? I can only think, how can Harrington possibly handle 15 towns for the general population if our seniors right now were told 2 months wait time for some of their appointments?
Right.
And
I can appreciate that. And what the state has told us is Harrington is our little gem here that they've let us do because we regionalize with them. Most hospitals aren't doing that. The state, under not even pulling any punches, under no uncertain terms, has told us that they want everybody to go to the mass vaccination sites. They do not want to stand up small clinics and locals. We are actually in the bottom of the list right now, which is really, really, really tough for local public health that's been prepping for this stuff for years. They told us they've come out and blanketly said they want everybody going, whenever they can get there, get to the mass vaccination site. One of the reasons why they opened up the caregiver to accompany the 75 plus is they're trying to get people out of their house and driven to these sites so they can run them through these sites at 1,000, 2,000 a day. They really want everybody there. They haven't even lied about it. They've come right out and told us in our meetings. That's what they're looking to do. So they're not even saying that we can possibly get one. They're telling us right now they will not give us any local sites for one town off stuff at this time. Will it change in the future? Possibly. And if it does, we will hopefully have our MIS number in place, an MCPP number, and the prep mod taken care of. So we could do that. That's where our hope is. But right now, they've asked us to go regional, stand up clinics that are going to be 90 days plus, and staff these things the best we could. And they want them to be 500 to 1,000 vaccinations a day is where they want to be in a regional area. And we signed on to a regional plan to get Harrington up over 500 vaccinations a day, hopefully get Palmer up over 200 vaccinations a day, and maybe get another clinic close to Webster up and running so we could be 1,000 plus a day in our southern Worcester County region. That was what our regional plan has been through FEP and TriEpic and working that way. It's our first time we've done this kind of regional in my 20-year experience.
Are you saying Webster's going to be a state site?
Nope, I'm saying that was
Okay.
that was a larger plan of the Harrington catchment basement. What we're trying to do is hit that 1,000 plus a day vaccinations. And that's the goal. Whether we hit it or not is going to be sort of up to, do we get the vaccines and do we have enough people to staff this? All these towns are pulling the same volunteers and pulling the same people to do this work. So there's only so many people you keep pulling to do the same work when you stand up a clinic for more than a week.
And I would also like to add to that you are ahead of the game of many Massachusetts communities because you have two opportunities that you're providing to your residents right now, which I think that I commend the fact that you have put resources into two different initiatives to serve your population as best you can.
And also one other thing, Ken.
Otherwise, we would have to send them to Gillette Stadium or to some mall, correct?
Eastfield Mall, yes.
Yes.
Now, my question, hold on. Yeah, I just want to, I get it. Like I said, the seniors are doing okay now, but when it opens up to the general population, if they were being put on like a 2-month wait list, I had a few seniors call me that said we got an appointment at the end of March, and I sent them to Leslie, and then she was able to help them. But if that's the case with seniors, we'll just have to wait and see. The general population, like I said, Harrington, it's going to be tough for them to handle it. And I know they're doing it at malls. Does the state have to seek out towns to be a mass vaccination site, or do you take the initiative by engaging in that 3-phase system? Because I'm just wondering, we're going to have a vacant, J.C. Penney, for example, and that's just as big as the Armory in Southbridge. And I didn't know, if that's a possibility. That's going to be, they're going out of business. Why isn't that as good as Eastfield Mall?
Mary,
it's already been mentioned.
Yeah.
We discussed that regionally as an opportunity because of the location and what we can get right off of 131. But let me take a couple of steps back, because I think part of our scenario is that everybody still thinks it's like a flu clinic, and we're being dispensed like a flu clinic. The federal government took a pretty hard stance to privatize the vaccination of our country. They took it out of public health's hands right now. They have partnered with CVS, Walgreens, and other pharmacies to distribute that directly to them, to the point where they're circumventing our state and getting it right in their hands, to a point where they're looking at doing 5 or 6 vaccinations an hour at these CVS and Walgreens, where we could do hundreds. And they don't want it in our hands right now. They're shifting it then. We don't have enough vaccine. And their expectation, and we've been told this, is that by the time the general population comes, there will be enough vaccine at the doctor's offices, the CVS, the Walgreens, at the mass vaccination sites, that they won't have to stand up all these small stuff and work with us on this. They've come out and said this to us.
Okay, is the CVS on Sturbridge a possibility? Are they going to get them?
They're supposed to be starting tomorrow, from what I was told. Their appointments are supposed to open up tomorrow for vaccination.
Okay, and they're going to stay with it into the general public?
I can't comment on that because I don't know. It's like I said, they privatized this. They've tied our hands a bit on the public health side. It's really tough.
Okay.
And it's only, those CVSs and pharmacies are not going to be the solutions for everybody, because they're only 5 to 6 vaccines an hour. That's all they have the ability to offer. And I wanted to go back to your questions about mass vaccination sites. It's not a community that is standing up a mass vaccination site. These are private locations that are taking on, at the request of the governor's office, from what we understand, these the super sites is a better way to say it, because Massachusetts and Mass are just too confusing. But I think ultimately these super sites are on private property, and they are being put together by private property. So to Ken's point about privatization, it's not like the city of Worcester can go to the governor and say, hey, we'll be a super site. It's through Worcester State University. They're all private entities on all private facilities, that the way that it's being pushed forth right now.
I understand. All right. I can't stay on longer. I just, thanks for the information session, but I don't know who's taking meeting minutes. I am just going to express, I guess it's my disappointment. I think it's great that you're doing this informational thing this evening, because I get a lot of questions and I direct them accordingly. But I am disappointed that you also were not willing, or I guess available, I don't know, too busy, I don't really know the reason, that you also couldn't, and I'm just expressing my own feelings. I am disappointed that nobody was going to come to the Board of Selectmen meeting, and sometimes different people watch different meetings. I hope a lot of people are watching this tonight. That's excellent, but I didn't see it as an either or, because we really hadn't had a joint meeting since March at my request, which is almost a year ago. So it's not like you come to the board a lot, and I thought it was unfortunate for us that you were not able to fit it into your schedule, because I think it's unfortunate. I think the public would have benefited from having this information session tonight, and different people watch selectmen meetings, and you could have been an agenda and got us up to date on what was going on. So again, I'm just expressing my own personal disappointment that it didn't happen. So anyway, thank you, everybody. I am going to hang up. If possible, perhaps somebody could prepare some kind of a memo so that we can read it at the selectmen's, because, like I said, we do get a lot of questions. And I don't think our chair, hold on, let me just finish. I just want to finish. I know when the Board of Health has wanted to come before the selectmen, I can't speak, but I don't think our chair has ever not given you an agenda item and said, no, we're too busy. And I just think it's unfortunate that you couldn't have also given us information as well. As I said, it doesn't happen a lot. It was a year ago. It was like last March. And that was very informative. We had the fire chiefs were there, and it really got things off the ground. And it's just disappointing. I don't know. But anyway, I do have to go, and I thank everybody for their time. And that's it. Thank you.
Okay. All right, thanks. Is there anybody else, Rich, since you haven't had an opportunity to ask any questions, did you have any questions?
No, not really questions. I know a number of people who've gone through the Harrington situation, and nothing but bravos about how well that system works. And
Right.
as far as the computer system and stuff to get appointments, and I know some people are not that well on computers. People I know it's taken them less than 10 minutes to get an appointment.
Okay.
When they go, they're given a second appointment that day, so you know when you're coming back. So everything I've heard has just been run very well down there. And I think
That's the other thing I know, that because it's not like a typical flu clinic too.
Yes, you got to sign in. They got to keep
make sure that we can get the second appointment too. So these people also, Harrington,
right.
when they do the first appointment, they have to make sure they have the space to do the second appointments and so forth. So it's gonna.
We're way ahead of what I've heard from other. I know
Absolutely.
people.
I know we are.
It's a nightmare compared to us.
And hopefully the public will hear and see our message. I think that we made the announcement that we were going to have a COVID vaccination update for the general public. So I hope that people that were interested will have an opportunity to review this. And we'll also make sure that we post the PowerPoint presentation also on our website, right, Ken? So that'll be out there so people can read it. And if you can also send the PowerPoint to the selectmen so that if they have any individual questions too, we'd be happy to, from anybody actually, from the public. So is there anybody else who might be on the line or have any questions?
Madam Chair,
Okay.
let me check, please.
Sure, thank you.
Good evening. Is there anyone on the public line that would like to ask the Board of Health a question about the COVID vaccination process? There's no one on the line, but we can replay this meeting over the cable channel several times a week to make sure this message gets out.
Oh, great, thank you.
That's great.
Jeff, do you have any questions for us?
No, I think, you've explained it well tonight, and the challenge faced with opening local sites. I think over time, and I understand the CVS and Walgreens will have limited supply, but it's about having options for people. And as more vaccine becomes available, which is really where the bottleneck is right now, the availability of the medicine, and as that supply chain ramps up, more and more opportunities, less and less time it takes for people to get one. So everybody wants to be at the front of the line, which is understandable, and everybody's doing the best they can.
Okay, all right. Jamie, do you want to add anything? I guess everyone's pretty much had something to say, so.
I appreciate you guys asking me to come on and talk to you, and I can hear the frustration that Mary put forth, but I don't think that it's anything that you have done or not done as a board and as the health department. I think you are doing everything that you could possibly do, and more than most health departments have the bandwidth to do right now. So I feel like you are serving your citizens very well, and you should be proud of that. This is a really hard, challenging thing, and hopefully in all of our careers, we never have anything this hard to deal with again.
Yeah, great. Thanks, Jamie.
Thank you.
Thanks,
Thanks for
Jen.
coming on, Jamie. Appreciate your help.
Yep.
Yeah. So, Jamie, do you want to give out your cell phone number? So, I'm kidding.
I don't. Thank you. While I'm on my call with you, my phone is blowing up about some other things to deal with. So.
No, I'm kidding. Thank you very much. Thanks for joining us.
Thank you.
I'll just say we can adjourn the meeting. Do you want to vote?
Yeah, I second the motion with Foppe.
All right, Linda Cook-Callis, let's adjourn. Thank you very much,
Thank you.
everyone.
Thank
Take
you.
care,
Everyone, make sure you have questions.
Thank you, guys.
Thank you.
Thank you.
Bye-bye.
Good night.
Bye.
Bye. Good night, guys.